What was your "you need to see a doctor" moment? Story 1. When I was lying in bed, I suddenly felt pain in my back. I took some painkillers, thinking it would go away. Nope, it just got worse fast. I woke my mom around 5 a.m., begging for help. She refused, got mad at me for waking her, and went back to sleep. 2 hours later, I was curled up on the bathroom floor, unable to stand. The pain was so unbearable that all I could do was throw up endlessly and cry. My mom finally called an ambulance, and the paramedic was furious with her. I spent nearly the entire day at the hospital. It was a kidney stone. I have never felt such pain before or since. Story 2. When my appendix ruptured at midnight. I had been feeling a weird dull pain for the last few days, but this felt like I'd just been stabbed and actually made me see stars. I ended up going to my next door neighbors, who I'd never spoken to before, and begged the wife to call 911 for me. Instead, she yelled for her husband. He asked me a few questions, poked me a few times, and asked me to jump. When I couldn't, he drove me to the hospital with his wife. On the way there, he called my hospital and told the person on the other end of the line, "This is Dr. Anderson," fake name. "I'm bringing in a patient with insert medical terms here. ETA, whatever time." And then a whole bunch of directions that I can't remember. That's when the wife informed me that her husband was the medical director of the hospital I was headed to. Once we got to the hospital, it was honestly one big blur, and I was only conscious for some of it. I ended up being rushed into surgery and stayed in the hospital for roughly a week. To add a wholesome note to the story, the medical director's wife stayed by my side for the entirety of that week, even while I was sleeping or unconscious. She also drove me home after I was discharged, and she and her husband became like second parents to me until they retired and moved to be closer to their own daughter. Story 3. I had arrived home from school around noon and went to sleep because I wasn't feeling well. I woke up at 4 and freaked out that I was late for wrestling practice, which had started at 3. I bolted out the door and drove myself back to school. By then, practice had already been going on for an hour and everyone was ready to go. I had just woken up, still felt awful, and was stiff as hell. My partner was drilling his double-leg takedown on me across the room. The room was old, and the mats weren't even touching, so there were gaps in between. My partner shot in and got a solid double, but my ankle got caught in one of the gaps. My body went one way, and my knee went the other. He finished his shot, and we came down, and his body weight popped my knee back in. I tapped him saying, "Get off, man, get off." I looked down and saw my kneecap was more toward the back of my leg than the front. I screamed, and my coach came over to see what the hell was going on. The whole team crowded around to see, and my partner kept saying, "You can punch me if it makes you feel better." The coach called the sports trainer. The trainer took one look and said, "I'm not touching that. We need to call paramedics." The paramedics showed up and told me, "If you straighten your leg, maybe it'll fix itself." That didn't work, so they said, "We're not touching it without an x-ray. You need to see a doctor." So I was finally hauled away, only for the doctor to just slide my kneecap back into place with his thumbs. He said, "On the count of 3, but slid it back on 1. Man, that was a good day. Also, there was the time I started coughing up blood when I contracted swine flu in 2009, but that's a whole different story. Story 4. I was 33 and a half weeks pregnant with twins when I started having the most insane pain in my back. I was on home contraction monitoring, and they said my contractions were going crazy, so they had me go to the hospital. I had originally gone into labor at 26 weeks, so I'd been on a terbutaline pump since then. My doctor thought my body had gotten too used to it, so they decided to hospitalize me and flush it out of my system with magnesium sulfate. I was in the hospital from Wednesday to Saturday. They released me, and we went home. I was home for less than an hour when I knew something was really wrong. So we turned around and went back to the hospital. The labor and delivery nurse told me I was overreacting and that it was just round ligament pain, so she didn't call my doctor. Only the doctor on call for the practice. They put me back on magnesium that night until my doctor came in for his normal rounds the next morning. When my doctor arrived, he immediately knew something was drastically wrong. He put me in a wheelchair himself and wheeled me to his office, which was in another wing of the hospital. That's when they realized I was in kidney failure. I ended up being taken by ambulance to a hospital 3.5 hours away that had a pregnancy intensive care unit and a level 3 NICU. After delivery, my OB and perinatologist both came to visit. It was only in retrospect that everyone realized how sick I truly was because the magnesium sulfate had artificially lowered my blood pressure, so no one had seen the severity of my condition. I had preeclampsia with HELLP syndrome and hydronephrosis. My OB told me that if we hadn't come back to the hospital on Saturday, my sons and I would all have died that night. Story 5. I got into a car accident at slow speed after leaving work early to travel for my mom's birthday. I was sitting at a light when I heard something weird behind me. I had just enough time to look in my rearview mirror and see a dump truck slam into a BMW, which then collided with a Civic behind me. I tried to move out of the way as the Civic hit the back of my car. Turns out the dump truck driver didn't realize there would be cars on the other side of the hill. Luckily, no one was severely hurt. The BMW was crunched, but the man inside was able to walk. I thought there was no real damage besides a small cosmetic issue on my bumper, so after the police took statements, I went home. All weekend, I had a small headache that I chalked up to allergies. On Monday, I went to work, sat down at my computer, and suddenly watched the whole screen rotate clockwise while my vision went haywire. A coworker came over to chat, took one look at me, and said, "You need to see a doctor now." I went to a local PCP, and it turns out I had hit my head in the same spot I'd injured during another car accident a few years earlier, the one where I had retrograde amnesia and was basically resetting every 15 minutes, Memento style. Honestly, I have zero memory of that accident. Incidentally, it also happened on Mother's Day. The doctor determined I had a concussion and put me on no screen time. I work with computers and limited reading. Moral of the story, get checked out even if you think you're fine. Also, if you're me, don't drive on anything related to your mom. Story 6. My hand was very red and swollen from an infected cat bite. I had been walking past my cat and went to give him the usual head-to-tail back rub I'd done a million times before. But this time, at the exact moment my hand made contact, I accidentally stepped on his tail. He spun around and bit my hand so hard it felt like it was in a vice grip. He let go right away, but his teeth went all the way in. I cleaned it and thought, it'll be fine. Wrong. 2 days later at work, someone asked, "What's wrong with your hand?" My coworkers convinced me to go to the doctor. The doctor took one look and gave me that, "I'm not mad, I'm disappointed" expression. He told me I should have come in immediately. Then he squeezed my hand, pus leaked out, and he prescribed antibiotics before sending me on my way. For the record, my cat is a sweetheart and has never bitten anyone before or since that isolated incident. I just scared him and hurt him at the same time. Story 7. I was recovering at home the day after SVT surgery when I developed a fever that wouldn't go down. My pulse rate was climbing too. The surgeon was a little concerned, but decided to play it by ear. The next day was July 4th, and I had to cancel our family trip to see the fireworks. Our city launches them from the school next to my workplace, so every year we'd go to the office and get a perfect view as a perk of working there. I hadn't missed one in 9 years. But that night, I was struggling to breathe, and my fever was higher. The disappointment on my son's face was heartbreaking. By the next morning, my symptoms had worsened, and I was gasping for air, even while sitting down. I went to the hospital, where they discovered I had picked up a lung infection, likely at the hospital during my SVT procedure because the air handler in the OR was faulty. One of my lungs had effectively collapsed, and the other was headed the same way. The doctors told me it would have been fatal within a couple of days without modern medical care. They put me on a Z-Pack, and within 48 hours I was back to normal. Story 8. Not a moment when somebody else needed a doctor, but when I needed one immediately. Kinda long, but bear with me. It was finals week at the end of my first year in college. I had finished 2 of my 3 finals and decided to work out at the campus gym. After about 25 minutes of biking, I started feeling a pain in my back. At first it was tolerable, but it kept getting worse, so I cut my workout short and walked back to my dorm. The whole time I was walking, I had this throbbing pain in my lower back. The gym was only about a quarter mile away, but I had to stop twice. When I got back, I lay down, tried to nap, and watched some Netflix. 3 or 4 hours later, I started getting hot and sweaty, with waves of nausea. I also had a UTI. I tried going to the bathroom, crouched in front of the toilet, but nothing happened. An hour later, I started projectile vomiting, nonstop for 2 hours, screaming from the pain as I threw up. At one point I had to pee but couldn't hold it. I grabbed a towel and used that. I called my boyfriend, who said he'd visit the next day with medicine, and I called my mom, who was of course worried. I finally fell asleep at 1 a.m. and didn't wake up until 1 p.m. the next day, drenched in sweat and still in pain. My mom texted me threatening to call campus police because she thought I was dead. I could barely walk, but forced myself to shower. I was so exhausted I had to sit down in the shower to wash myself. My boyfriend showed up later with cranberry juice, ibuprofen, aspirin, cold medicine, anything he could think of. Meanwhile, I hadn't used the toilet at all because I couldn't hold it, so I'd been peeing on towels, old clothes, bowls, even in my hamper. My whole room reeked. My boyfriend was disgusted but helped me clean as best he could. I kept begging him to take me to the hospital. He insisted it was just a bad cold, that I had my last exam tomorrow, and that a hospital visit would be too expensive. That night, I couldn't sleep from the pain. In the morning, my boyfriend left for his exam, and I tried to get ready for mine. I could barely stand in the shower, eventually laying down in it. Dressing myself was exhausting, so I threw on random clothes and left late for class. By the time I reached the main building, I couldn't walk anymore. I collapsed onto a couch in the hallway and couldn't get up. I emailed my professor, telling him I was too sick to make it. My boyfriend found me after his exam. Still against the hospital idea, he suggested the campus wellness center. I couldn't walk, so he rented a wheelchair and pushed me there. Every bump in the sidewalk sent waves of pain through me. At the center, the nurse practitioner took one look at me and said, "Do you normally use a wheelchair?" When my boyfriend explained I didn't, she immediately said, "You need to go to the hospital right now. You should have gone as soon as these symptoms started. This looks like a severe kidney infection that's getting worse by the hour." She insisted on calling an ambulance. My boyfriend begged to drive me himself, and she reluctantly agreed but warned she'd call one if he wasn't back in 20 minutes. She kept checking on me in the waiting room, visibly worried I'd collapse. We ended up stopping at an urgent care where they took my temperature very high, tried to get me on the exam table. 2 doctors had to lift me and tested my urine. My white cell count was 31, which they said was dangerously high. They told me I had a severe infection and immediately called an ambulance, saying my condition was potentially life-threatening. My parents arrived just before the ambulance did and insisted on driving me to the hospital near home. At the hospital, they discovered I had a large kidney stone stuck between my kidney and bladder. I was admitted on Friday, and on Saturday an emergency surgeon was called in to remove it. The infection was so bad that the stent he used got stuck in the inflamed tissue around my kidney and had to be removed weeks later. I spent 5 days in the hospital, ICU, endured excruciating pain, and racked up a $99,000 bill. Thankfully, insurance covered most of it. Wouldn't wish that on anyone. Story 9. I had just had a very minor surgery to drain and clean a severely infected cyst on my shoulder. They actually messed up the numbing, so I felt the entire process and kept telling them I was in pain, but they ignored me. Afterward, the doctor basically shoved me out of the office, told me I was fine to go back to life as normal, stuffed my shoulder with gauze, and instructed me to pull it out myself in about 12 hours. I went home in incredible pain, unable to move my arm or stop the bleeding. Not wanting to be a baby about it since the doctor had said I'd be fine, I just took some melatonin to knock myself out. The next morning, I woke up with my entire arm swollen to about 1.5 times its normal size, including all my fingers. I had a fever, wasn't speaking coherently, was struggling to breathe, my heart was pounding, and I was in extreme pain. I, stupidly, went to work anyway, and my boss took one look at me and told a coworker to drive me to the ER. Turns out, I was septic, and that's how a supposedly minor surgery turned into an emergency room visit. Story 10. I woke up one morning unable to sit up without excruciating pain. My whole abdomen felt like it was on fire, and I couldn't keep anything down. Around 5 p.m. that day, I decided to go to Hospital A. I sat in the ER waiting room forever, begging them to see me while on the verge of passing out. They finally did, ran no tests, gave me morphine, told me it was just muscle pain, and sent me home to drive myself back. I stopped at my mom's to pick up my dog, and when he jumped on me out of excitement, it sent me into a whole new level of pain. I went home and tried to sleep. The next day, I kept feeling like I desperately had to poop. The urge got worse throughout the day until I was nearly passing out just walking to the bathroom. That's when I decided to make another hospital trip, this time to Hospital B. As soon as I got there, they brought me into triage. My blood pressure was dangerously low, so they rushed me back immediately. After explaining my symptoms to a rather large male nurse, who used to be a cop, he ended up getting to know me far more intimately than I would have liked. Let's just say I hadn't considered how big his fingers were until that exam. After a few failed attempts with contrast during the CT scan, they discovered that my spleen had ruptured. That pooping sensation I kept having was actually blood pooling up in my abdomen. I spent a week in the ICU, received 4 bags of donated blood, was pumped full of Dilaudid, and endured a month of bed rest. Thankfully, I pulled through and was eventually good to go. Story 11. I couldn't pee or poop for around 3 days. It finally hit me that something wasn't right, so I told my mom. She immediately said I needed to go to the hospital. My dad and I tried to downplay it, saying, "Nah, it'll be fine," but my mom wasn't having it. She forced my dad to take me in because not peeing for 3 days is definitely not normal. I went to the hospital thinking they'd laugh at me and send me home. The doctors examined me but couldn't figure it out right away since they'd never seen symptoms like mine. They suspected appendicitis, ran some tests, and initially found nothing. Hours later, after checking the scan again, they realized I had a condition called situs inversus. Basically, my organs are mirrored inside my body, non-life-threatening. My appendix wasn't where it was supposed to be, it was on the other side. Once they located it, they saw it was badly infected and I needed emergency surgery. I ended up spending 3 days in the hospital. Not fun, especially the catheter they put in me. Story 12. I was born with weak ankles, and when I stand or walk, they jut outward instead of staying straight. Because of that, they often give out, and I've had more than my share of sprained ankles. One day, I was walking out of my room when my ankle buckled. To avoid another sprain, I let myself fall into it, but I slammed my hip hard against the wall. There was a loud pop, a sharp pain in my hip and leg, and I couldn't stand up. My brother came in after hearing the noise, and when he couldn't get me off the floor, he got my dad. My dad insisted it couldn't hurt as badly as I was saying, told me to stop being a baby, and forced me onto my feet. I felt another pop as my hip slid back into place, and I screamed in pain. He just told me to calm down and walk it off, that I'd be fine. But I wasn't fine. For months, eventually years, I told my parents how much it hurt to walk, to sit, and how the pain in my hip was keeping me from sleeping. They just gave me ibuprofen and said if it didn't heal in a few weeks, they'd take me to the doctor. They never did. They seemed convinced I was faking it. I developed a bad limp, and teachers, friends, and classmates constantly asked me what was wrong and encouraged me to see a doctor. Eventually, I told my mom's parents, who knew firsthand how serious hip injuries could be. They pressured my parents to finally get me medical help. The doctor confirmed there was muscle damage and that I likely had a hairline fracture. I was prescribed physical therapy, but was told that since it had been left untreated for so long, it had healed incorrectly and I would probably need surgery in the future. If my parents had believed me and taken me to the doctor right away, my hip would have healed properly, and I wouldn't be living with chronic pain now. Story 13. I'm some magical combination of stupid, stubborn, and prone to ER visits. I'd already been sick for a while, and my housemate had pointed out something was wrong when I showed him a bump on my ribs. He told me I looked like Skeletor, but I tend not to worry about things, and since I didn't have health insurance at the time, I was hoping I'd just get better. Eventually, I went to the ER just for a diagnosis and meds. The doctor gave me a quick once-over, said I probably had pneumonia, wrote me a prescription for secondary infections, and sent me home. On the way out, I mentioned my middle toe hurt. He wiggled it, said it was probably broken, and told me not to walk on it too much. Then I walked home. The next morning, I woke up to what's still in the top 3 worst pains I've ever felt in my leg. When I pulled the sheet back, my leg was swollen several times its normal size. I'm slim, average build, and it looked like I had an obese person's leg attached to me. Being a genius, I decided I'd go pee first and figure out what to do after. I sat on the toilet, dizzy and nauseated, thinking, I'm so tired of feeling sick. That's when I heard drums. Slowly waking up, I thought, I don't remember going to a luau. Maybe I got drunk and forgot where I am. Then I opened my eyes and realized the drums were actually my legs spasming, banging against the toilet as I lay in the shower. At that point, I did the obvious thing. I called my mom. I told her I thought I'd had a seizure, my leg was swollen and changing colors, and I didn't know what to do. She said, Go to the fucking hospital. In the most how are you even alive tone imaginable. I agreed and called my housemates until I found one home to drive me. He asked if he should come help me, and me being me, I said, "No, I'll meet you out back. I just want to change out of my PJs." I crawled back to my room, spent 15 minutes struggling to change, and when he knocked, I crawled to the door. "Okay, finally got them on," I said. He looked down at me on the floor and asked, "Do you need help?" I insisted I was fine, tried to hoist myself up, and immediately collapsed from the pain. This poor guy carried me to the car, drove me to the ER, helped me fill out paperwork while I was half melting out of the chair, and demanded they stop calling me up and get me a wheelchair. The rest was a blur of being admitted, very high, and clueless. I wouldn't even have known half of what happened if my mom hadn't taken notes. I didn't realize how serious things were until a doctor came in after a few days, examined my leg, and said, "I don't think we'll need to cut anything off." That was the first time it hit me. Later they explained I had cellulitis and had gone into septic shock, which could absolutely have killed me. They couldn't identify the pathogen, so they put me on fluoroquinolones, which I later learned are a black box drug reserved for extreme cases because of the risks. That wasn't the only time I had to be told to go to the ER. Once, I had a stroke, but the symptoms weren't typical. It affected my occipital lobe, so I just saw hallucinations with no history of migraines. Even the nurse I called wasn't sure until I casually mentioned my neck was sore when I woke up. Then she said, "Oh, go to the ER." Another time, I had severe food poisoning at a conference. I'd lost pretty much every fluid my body had, and my boss finally insisted I go. A student drove me to the ER and even filled out my forms while I vomited into a trash can. They offered to let me go home or stay overnight. For once, I listened to my instincts and stayed. Not long after, I passed out as alarms went off, surrounded by staff. Turned out I'd had a severe electrolyte imbalance. And one last note, though it's not quite the same. A friend told me to go to the ER after a sexual assault. I'm glad I listened. The treatments for HIV, morning after pill, etc., and tests, swabs, are time sensitive. You can make tough decisions later, but you can't go back in time to get those treatments. In my state, there were special funds to cover medical and incidental costs for victims, including cab fares and counseling. If that ever happens to you, please go right away. Story 14. I went up into the attic for the first time this past Christmas to get the decorations. I was worried my mom might hurt herself, so I went instead. I stepped onto one of the planks, thinking it was on a beam, because I'd been told to stand on a beam, and crouched down since the space was tight. My mom calmly told me I needed to get down. I thought she was just being dramatic and worried. Then she said, "You're coming through," but I couldn't tell since I was standing on a wooden plank. As I shifted my weight to head toward the ladder, the plank gave way. I fell straight through, kind of doing a half somersault because of how I was positioned up there. My chin was pressed against my chest, and I landed flat on my back after the ladder smacked my face. A small nail went into my arm on the way down. I hit the floor so hard that it knocked the wind out of me, and I blacked out for a few seconds. All I remember is hitting the ladder, then opening my eyes and hearing everything around me. I couldn't breathe at all. In that moment, I was 100% sure I was going to die. I didn't know if wood, nails, or something else had punctured my lung, but I couldn't get air in. My back was screaming in pain, my wrist was bleeding, my face hurt, and all I could do was hyperventilate while begging my mom to call an ambulance. As someone who's terrified of hospitals and always avoids them unless it feels life or death, it was the only thing I wanted. My mom started yelling at me to get up. Somehow, in all the chaos, I managed to stand with her help. She got me to the couch and checked me over to see if anything had punctured me beyond my arm. Thankfully, nothing had. I calmed down eventually, and we decided not to go to the hospital. But I couldn't get up by myself for 2 weeks. I had massive bruises on my chest and arms, and my chest was sore from the impact of my chin slamming into it when I hit the concrete. And since our ceilings are abnormally tall, the drop was about 11 feet. Honestly, I feel like I escaped death because so many things could have gone very, very wrong. Story 15. For the record, I did tell him to put gloves on. This all happened last year. My fiancé was chopping wood to make kindling inside the living room because it was nighttime without gloves for protection. I was pregnant at the time and just watching him, kind of fascinated, when I realized the laundry was done. I went to put the clothes away in the bedroom, and not even 5 minutes later, I heard him yell, "Fucking shit." Then I heard him running to the kitchen sink, repeating "fuck" over and over. I yelled, "Are you okay?" And he shouted back that he was, even though he kept swearing nonstop. I walked into the kitchen to see what happened, and there it was, a big, deep gash on his hand, right around the thumb area near his wrist. I panicked, got lightheaded and pale, and said, "We need to take you to the hospital." He kept insisting, "It's okay, I'm fine." And I was like, "No, you're not. We need to go now." But I was so close to passing out myself that I had to lie down on the floor. My fiancée knelt beside me, rubbing my stomach and saying, "It's okay. It's all gonna be okay." I just started crying, and then my stomach began to hurt while the baby was kicking like crazy. Just remembering it makes me emotional all over again. In the end, we never went to the hospital. About a week later, our baby girl was born. Story 16. When I dyed my hair as a birthday treat for myself, it stung a bit while I was doing it. So I leaned over the bath and rinsed it out earlier than I should have. In hindsight, that was the moment I should have gone to the hospital, but it didn't look too bad, just some redness around my hairline. The real danger came when I suddenly started feeling very sleepy, so I went to bed early. I woke up at 5:45 desperate for a pee, but unable to get out of bed or even sit up. I kept slipping into these strange dreams where I thought I'd gone to the bathroom, only to wake up and realize I was still in bed. Luckily, my grandmother called me and noticed I was slurring my words just before I passed out on the phone. The next thing I knew, there was a knock at the door. My grandma had come straight over. By then, my head had started to swell, and a mix of white blood cells and hair dye was running down my head and neck. She rushed me to the hospital, where they told me I was having a severe allergic reaction to the dye and gave me medication. The swelling was so bad I couldn't fit my head inside my hoodie hood. By the time I got home, I couldn't even open my eyes because my eyelids were so swollen that my eyelashes were pressed against my eyeballs. Since I had rinsed my hair leaning over the bath, the only part of my face unaffected was my mouth. I looked like a gray alien, bulging head and eyes, tiny mouth. And that was only the beginning. Over the next week, I lost half a stone, 7 pounds, from the swelling and the sheer amount of white blood cells my body was producing. In total, I ended up losing about 4 stone, leaving me underweight. My skin ruptured and bled constantly, and my hair started falling out at an alarming rate. My neck swelled so much it began closing my throat, making it hard to breathe. The swelling went down relatively quickly, but the bleeding, skin damage, and hair loss took years to recover from. Even now, decades later, I still deal with allergies. On high pollen days, I sometimes get blisters on my ears, and things I'd never been allergic to before started setting me off. I still take antihistamines and sprays regularly, and always keep tissues on hand, just in case. And the kicker? The dye never even took in my hair. Story 17. I had routine sinus surgery and was taking longer than expected to recover. Then I noticed my throat was getting really sore instead of improving. The next morning, I had trouble swallowing and figured maybe it was just sinus drainage from the surgery. A few hours later, I realized that when I opened my mouth, my uvula was pointing sideways, and I could barely talk. I took some Advil, but my wife insisted I see the doctor. She took one look and sent me straight to the ER. I still wasn't sure what was going on or why it was such a big deal. At the ER, they triaged me immediately. The doctor looked down my throat, sprayed some anesthetic, grabbed a pair of scissors, and suddenly jammed them down my throat. Turns out I'd picked up an infection during surgery, which had caused what the doctor called a quinsy, an abscess around the tonsils. I was apparently about 20 minutes away from the abscess growing large enough to cut off my airway and suffocate me. I spent the next 2 weeks in the hospital recovering from what had become a full-blown MRSA infection in my sinus cavities. Moral of the story: listen to your wife. Story 18. When I was in high school, I went to a big group dinner at a friend's house on a Saturday night. I got home around 1 a.m., but since I hadn't had much exercise that day, I felt restless and decided to go for a run. 2 miles later, I was vomiting everywhere. I couldn't keep anything down for 2 days. I just lay on the couch in misery, vomiting every few hours no matter what was, or wasn't, in my stomach. Around 4 a.m., I had a dream about a crazy-looking leprechaun telling me that if I nibbled the corners off a saltine in just the right pattern, with sips of Sprite in between, my vomiting would magically stop. I woke up needing to vomit again, ran to the bathroom, and spent a few minutes trying to turn myself inside out. When I sat up, the leprechaun was sitting on the counter, telling me I should have listened to him. That's when it clicked. I was having full-blown audio-visual hallucinations. My brain screamed, "You need to go to the hospital right fucking now." I pounded on my parents' locked bedroom door until my mom opened it. I managed to say, "I need to go to the hospital," before blacking out. I came to a minute later with my mom freaking out, then we bundled into the car. On the way, I blacked out a few more times before we reached the hospital, where the doctor assumed I was on drugs. He kept asking what I had taken and didn't believe me when I said nothing. Then they checked my vitals. My heart rate was 223 BPM. Still convinced it was drugs, the doctor kept pushing until my mom told them she was diabetic and suggested they check my blood sugar. It was over 500, normal is 80 to 120. Turns out I'd inherited a genetic form of diabetes and was in diabetic ketoacidosis. The blackouts were the start of a diabetic coma. I blacked out again, and they wheeled me into the ICU, where I spent 5 days recovering. Later, my mom told me that while they were transferring me from the ER to ICU, they used a huge elevator big enough for the bed, her, and a couple of staff. As the doors closed, they made a loud warning sound. My mom, running on pure adrenaline, blurted, "I didn't do it." The orderly chuckled and started to explain, but before he could, I bolted upright, put on my best gravelly gunslinger voice, and said, "Nope, that's my machete," slapped my thigh. "I keep it right here." Then I dropped back into unconsciousness. Everyone turned to my mom, and she just shrugged like, "Don't ask me. I'm just his mom." It turned out that everyone at the party that night had gotten sick with some kind of stomach bug that lasted about 48 hours. We never figured out if it was viral, bacterial, flu, or food poisoning. But I was the only one with a latent genetic condition it triggered, so instead of a bad weekend, I almost died. Story 19. Mine is more of an I should have seen a doctor, but didn't. I had surgery on my foot when I was 14. Actually, I had 9-foot surgeries over the course of 3 years. This was number 3. They were always outpatient. Go into the surgery center around lunchtime, home by dinner. I remember because my mom, who was a bit psychotic about these things, made me go to school that morning since you don't have to be there until 1. Which sucked even more because I wasn't allowed to eat or drink, so I spent half the day surrounded by 1,000 kids with snacks and lunches. Anyway, that night I got up to pee. I hobbled into the bathroom, sat down, and looked down. The entire bathroom floor was covered in blood. Not like, oops I bled, but bleeding out levels. My dumbass thought, oh man, that's not cool, and started cleaning it up. I actually did a really good job, then hobbled back to bed. About an hour later, my mom got up to go to the gym and noticed all the bloody paper towels in the trash and footprints in the hallway. She came to check on me and found me asleep in bed, white as chalk. She started screaming for my dad because she thought I was dead. She woke up the neighbors with her screaming, but not my sister somehow. Eventually, I woke up too, screaming, because my mom never gave me pain meds after surgery. She was convinced I'd get addicted, so not even Tylenol. She called my podiatrist, who yelled at her to finally give me meds. She did, but since I hadn't eaten in almost 12 hours, I threw them up immediately. To make things worse, she had completely removed my dressings, releasing the pressure, so I was actively bleeding again. Then what does she do? She leaves for the gym, leaving my poor dad to deal with all the blood, vomit, and me. When she came back an hour later, she yelled at him because I wasn't ready for school. My dad calmly told her she was crazy if she thought I was going anywhere. The next day, even though I threw up 3 times while my mom and sister tried to give me a sponge bath, she still wanted to drag me to church. My dad had to step in again and tell her no, she's staying home. Thank God for him being the voice of reason. Later that day, I finally went to the podiatrist. Turns out I'd lost a dangerous amount of blood and should have gone to the hospital at 4 a.m. the first time I woke up bleeding. I needed a transfusion. But being 14 and dumb, I just went back to bed. I could have died. Story 20. I don't know if I need to see a doctor counts, but one day while playing video games, I started having severe tightness in my chest. I dealt with it for a few hours, convincing myself it was just stress, and went to bed early. That was Friday night. Saturday and Sunday I spent in bed with a fever. I didn't have a thermometer, but I knew I was in bad shape because I was shivering under 4 layers of blankets and clothes, with a pounding headache. By Sunday, even walking a few feet left me dizzy and exhausted. I drifted in and out of consciousness the whole weekend. Still, I convinced myself it was nothing. On Monday, I had to go to class. I vomited up my breakfast, a sandwich, and nearly collapsed walking across campus. I ended up leading a group project while barely conscious, coughing violently the whole time. That night, after vomiting up dinner and being unable to even keep water down, I finally decided to see a doctor. Turns out I had pneumonia. My fever was 106, and I was already beginning to develop sepsis. Because of a combination of risk factors, I had very nearly died. Crazy shit. Story 21. So, this is already pretty high up, so I expect my response to get buried. I had been dealing with severe back pain, like a level of pain I had never felt in my life. It started as an ache in my lower back, which I shrugged off, but soon I was walking from class to class hunched over. To manage it, I was taking aspirin and soaking in hot baths. I remember once in the bath noticing that my left leg was a different color than my right, blue. The breaking point came when I went grocery shopping with my partner. I collapsed in the produce section. An old woman offered me Tylenol, which I declined. Then I dragged myself back to my boyfriend's car. He just kept shopping even after I told him what had happened. The next day, still in extreme pain, I had to convince my boyfriend to drive me to the ER. Please note that I had to talk him into it. When we arrived, I couldn't walk long distances, so they wheeled me in. I could shuffle short distances, like to the bathroom, but I thought I was dealing with kidney stones. That's how bad the pain was. The ER doctor came in and said, "Well, you came in here in a wheelchair, but I've seen you get up and go to the bathroom on your own." Nothing on my charts showed kidney stones, which was my assumption. He denied me painkillers, clearly assuming I was drug-seeking. He casually suggested an MRI, or maybe another scan. I was out of my mind with pain, but I said, "Yes, all the tests." They did a CT scan. He came back to my room, eyes wide, and told me I was being admitted for immediate surgery the next morning. I had DVT, deep vein thrombosis. I was 22 years old. I spent a week in the ICU. I now have a stent in my hip that I'll have for the rest of my life, and honestly, it still hurts to this day. On top of that, they found out I have a rare genetic clotting disorder, which contributed to it, and I'll never be able to carry a pregnancy to term. Sucks to suck. If you enjoyed the video, don't forget to leave a like and subscribe, activate the notification bell, and share a similar story or anything you'd like to say in the comments. See you next time.